Hi guys, welcome back to my channel. In this video today I will discuss about tips and tricks for MRCP PACES exam before the exam and on the day of preparation. So most important tip is to attend the past test online videos. Do watch them times and again. Just subscribe to their videos. There are many videos which are free as well. So if you are an early candidate and you have enough time to go for exam, then give them a try to the offline ones. There are many videos which are available in offline modes according to the old and previous pattern. But the clinical exam, clinical cases and stations, they are similar to the new pattern. So you can follow the clinical because clinical is most important for the practice. Just if you're planning to give the exam in UK, then it's very important to subscribe to past tests, see the examination findings of the patient, because in white people the examination findings may seem different than our Asian or brown people. So do watch past test videos again and again to pick up clinical signs. You can do in a manner, once you are fully prepared and you have gone through all the videos, then you can mute the voice and pick up clinical signs by yourself, right? Note them down in your notebook and finally make a diagnosis on the basis of the findings that you found. So it will be a good rehearsal to catch up the cases and to know your preparation at what level you are. And if you have less time to go for exam, like only 3 months, then I would suggest to take online subscription and prepare according to the new pattern. Do practice all the cases from the past test, because past test is very good and it's similar to the real exam. Most of the cases are similar to them as well, even if you are an international candidate or if you are the candidate of UK. So again, past test is very important. Do practice all the cases from the past test, including the communication, including the clinical cases and history, basic clinical consultation as well, the long cases. And second tip, whatever course you are attending, with whoever is the mentor, either online or physically, just stick to the points. Make notes with yourself. Make notes of the important tips that the mentor are giving you. Each one of them have very good experience. Of course, they're teaching multiple candidates and they have got so much feedbacks from their candidates. So always note down, write it with yourself, because before the exam, just go through all these tips that you have written. Sometimes the tips are really helpful, and during the exam you can catch them as well. Like one of our mentors, they told us that if a patient will come to you in cardio station and the patient is tall and his legs are going out of the bed, then always consider that this is a Marfan syndrome. So you can correlate the cardiac anomalies that are seen in the Marfan syndrome. It can either be AVR, it could be DVR. So whatever features are coming in the Marfan, so if you connect to the syndrome, only then you will get the full marks. So it's very important to pick up the clues. And my third tip is that always pick up the clues from the bedside of the patient. Always focus on the surrounding of the patient. If the patient has a wheelchair around them, if the patient has some specific instrument that you need to examine the patient on, especially in clinical consultation scenario, because sometimes we do miss the examination steps that were essential and that had some marks. So always look at the bedside instruments, whatever it is. If it is hammer and you have not checked the reflexes, then you will be deducted on that step. If it is water or anything and you have not assessed the swallowing, then you will be deducted. So be careful about these things, that whatever is on the bedside, it is placed there intentionally to see if you are going to examine the patient for that step or not. Okay, like if there is inhaler, it means the patient is either asthmatic or COPD and using inhaler. If there is oxygen cylinder, always observe that how much oxygen patient is using, if the patient is on long-term oxygen. And sometimes they can place some medicine as well, like if a COPD patient is there and there are steroid tablets or anything. And very important next step is never forget to ask about the past medical history. Sometimes the patient will not give you past medical history, especially in the international center. The surrogates, they are not very prepared some of the times, and they may forget to tell you exactly that what are the medical conditions they have in the past. So always ask them to show you the medication list. even if they will tell you that we don't have any past medical history, once you will ask about the medication sheet or medication list, they will show you a big list of medication, and then you can easily judge that the patient is hypothyroid, patient is bipolar disorder, or whatever medicine you are seeing. Then you can correlate to the medicine, and you can ask the patient, you are taking, I have noted that you are taking this medicine, are you taking this medicine for, like if there is ramipril, then you can ask, are you taking this medicine for high blood pressure or heart failure or whatever is the indication in that. Then they will be more clear to you, they will make it more clear to you. So very important to ask about the medication list and any recent change in the medicine dose. If there is any recent change, then it might be possible that the patient is experiencing symptoms because of that, and the reason of coming to the hospital is also because of that. So never underestimate this point. Medication history is very, very important, and asking about the recent complaint or any change in medications, and if they say that yes, there is a change in medication, then next question should be always, did you notice that your symptoms are more worse after this change in dose? So that will make it more clear, and you will reach to the final diagnosis. Okay, so my fifth tip is asking about the social history. Sometimes we may underestimate, but it has its own score as well. So always follow the pattern: social history and occupation, and asking about driving, because each one of them have separate score. Each one of them is considered a separate criteria to give you a full score total. So as I mentioned in my previous video, that you need to get a good score in all of these skills, and it is mandatory to pass all these skills to get through the exam. So similarly, these skills are examined in all the stations. So it's very important to ask about all the details of the patient. Like occupation, sometimes we may underestimate it, but patient can come with interstitial lung disease, patient can come with berylliosis, asbestosis, that you did not ask, and you cannot catch the disease. So it's very important. And asking about the living as well, because in UK they consider social history and occupational history very, very important. And in the end of asking about the social and occupational history, never forget to give support, social support, occupational support. Make it a habit, because here they don't discharge the patient until patient is fully supported socially, and patient is having like the occupational therapist. I'm not talking about the occupational physician. It is occupational therapist. You should know what is the difference between the occupational therapist and occupational physician. Occupational therapist is the one who is making changes at the home. Like if osteoarthritis, or if a patient with disability is living on the third floor of a building, then the occupational therapy is the one who will arrange lifts for them, who will make adjustment for them. Like for Parkinson patient, they will arrange the rails along the in the bathroom, and many supports for them to avoid postural hypotension and these things. So occupational therapist is the one who will make changes to the patient's living condition, while occupational health physician is a doctor who will like if a patient is getting occupational asthma, then occupational health physician is the one who will help the patient to change either the job, or to change the position of the job, to change the duties in the same job. So it should be very clear that what is the difference between occupational therapist and occupational physician. And my next important tip is, whatever you have learned in all the months of preparation, always revise it, because you are not going to remember anything if you have not revised it in last 1 week. And next step is, do practice the examination cases daily. It is very, very important to practice all the cases daily, like one case of neuro, one case of cardio, one of GIT, and one from the respo, and present them in front of your study partner if they are along you, or in front of anyone who is in front of you. If there is no one with you, you can present the case in front of mirror, so you can see your body language as well, how you are going to present the case. And just consider that the person standing in front of you is the examiner. So always present the case, and if you want to listen to yourself again, do make a recording and listen to yourself again. Once you will listen to your voice, you will be in better position to point out your mistakes. So it's very helpful. And if there is no one with you that you can practice the examination on, try to do it on a big teddy bear or on a pillow as well. You just need to practice all the steps, that don't miss any of the important steps. And especially the neuro examination, focus on the findings, don't focus on the steps. You should be so much well practiced that when you are examining a real patient, you will not focus. It will be your habit that I will go to this step, I will go to this step, and you will focus only on the findings. And your next tip is presentation. Your presentation should be very crispy. An examiner really gets impressed when you give a crispy presentation, because if your presentation is not presentable, then of course you're not going to impress the examiner. But again, in this point, different mentors have different presentations. Each one of them will teach you another one, but go with one pattern. The standard one that I was following is PACES test one. First telling the diagnosis, and then telling about the important physical findings, and then differential, then investigation and treatment. This is usual pattern. First tell the diagnosis, then you tell about the physical findings, then the probable diagnosis, then they can ask you about differential diagnosis. Next question would be about the investigation and treatment. These are the usual question and expected question in any clinical cases. Okay, and then last tip about MRCP PACES exam: stay confident, stay bold. Whatever you have studied, stay confident that you are enough prepared. See as many patients as you can, pick as many findings as you can, but in the end, have faith in Allah, stay confident, and just before the exam, don't rush. Go in a nice dressing. If you are wearing something well and professional, then you will feel more confident. And then best of luck. Have trust and faith in Allah. And if you are not going, of course, whatever you have studied, you will get through the exam. But even if harsh luck comes, then don't give up on study. Keep on practicing from the next day, and try to sit in the exam for the very next attempt, so that all the things would be very fresh. And don't think that now you need more time. The time would be the same. It's only a day. When it is your day, it will come to you. Okay, best of luck again. And if you need any help or any questions regarding the MRCP PACES, you can ask me in the comment section. Thank you so much, guys. See you again with next exciting video. If you haven't liked my channel, please like the video and subscribe to my channel. Thank you.